Thank you very much. Thank you for the invitation. It's so great to be again between friends and old colleagues. So what I'm going to present is a more specific case in the context of what Chrysanthi has described. I'm going to present you my experience working for almost 2 years in one of these actors who offer residential care and child protection for unaccompanied children in Greece. Um, the general context was presented by Chrysanthi, but I have to say that many times the, the care of this the care of this population, which I have to say here, what we must all have in mind, what we are talking about children and adolescents that have lost what they called home. They have lost their family support. And also they are in this very difficult and challenging period of adolescence, growing up or becoming adults. So we have all these different types of difficulties or challenges to face. So many times we see that they are being treated as an administrative issue. How many are there? 3,000? Are there 2,000? Where are they exactly? Are they in camps? Are they in detention centers? So this makes it a very difficult issue. Uh, uh, and also, it brings up a very basic thing, a very basic problem in mental health. It's about how different sectors like protection or education, health, and mental health are collaborating between them. Because we know, I think we all know here that supporting children and adolescents is mainly about intersectoral collaboration. It has to do, as you already said, about mental health and well-being in school and education, but also access to all whatever is needed for a child to grow. I have to mention before I present the specific case, what we are talking about community-based mental health. That means that children are not in concentration camps, or they are in an urban setting. And according to UNICEF, we see some of the main characteristics. We're talking about empowering the natural support. We all always we must remember that even if it is a child that has lost its family and is in a different country, still these children or adolescents can be very strong people. They have capabilities. We're not just vulnerable people, not just victims. So we must find find ways to support their natural support systems. Um, uh, and I will go directly to the last part, but non-specialists should be also included in MHPSS services. This is very important. And for example, as Chrysanthi mentioned, in child protection, when we have shelters where uh, a number of people is working to support these children, and it can be mental health professionals, but also carers with different backgrounds. It can be teachers, it can be just people who hasn't, but don't have any kind of specific training. They are all involved in psychosocial support. They are all part of the life of these children, so all can contribute to supporting and promoting the mental health and well-being of these children. Also, we're trying to follow the international, the IASC, I don't remember the exact name at the moment, of the Intersectional Committee of the UN, that shows that mental health should be, when we try to cover the needs of people, we must work at different levels, which are all of these levels are interconnected. That means that sometimes we have just, it's not always about providing services from a specialist, like individual therapy or group sessions and so on, but also it has to do with working with a community, with a neighborhood, and also providing some basic services. So we cannot do one of these without having in mind all of the other. So it's very important that we work on all the different levels of this pyramid. And here, what I want to present here is the model that the home project, this NGO has been working. We can say that it has been following Bronfenbrenner's socio-ecological model. It's a rather an old approach that this Russian-American psychologist tried to bring the to, to, to bring the concepts of the social context and system theory into child development. So there are the different, as you can see, there are different nested environments in which each child grows. So this is where we have to be able to work in. Starting from the microsystem, which is the direct environment, is where the child lives and has it can be the family, or when there is not family, the carers or other children. Then the mesosystem has to do about interactions between the other systems and the relationship between people. For example, how home or the place where this child lives interacts with school. We have the exosystem, which is the indirect context or environment. And here a classic example is the father's work, the father's job. It's something that the child may never visit or have any direct relation, but it affects his life and his growth at many levels. And finally, there is the macro system, which has to do with the social and cultural values. Of course, we also must be able, the chrono system is being mentioned, that has to do with the different milestones, the different important time moments that affect children and adolescents. And we have to imagine that, especially for refugees, time plays a very important role. So if we go to the specific example, the Home Project is an NGO that is rather new. It was established in 2016. At the moment, it operates 14 shelters. In this period, it has provided services and care to more than 1,000 children. It can offer services to children from 5 to 18 years old, boys and girls. But also many times you have a case that since some of the girls the Home Project is facilitating may be pregnant or have given birth to a baby. So the babies and infant and small children are also living with their mothers. Also, one of these shelters, at first it was one, and now it's a rather new development. Two of these shelters have now are available for what we call 18 plus for children that have become have turned 18. This is important. It's a very good thing that the organization is flexible to do that, because there is always this gap in the transition between the services that are for children and adolescents and the services that are for adults. Many times, for example, there can be rules or laws that say that as soon as you turn 18, you cannot stay in this specific setting, or you cannot receive services, and you have to change. And that can be very difficult. So it's important to be able to have this kind of shelters. So in these shelters, there are children from 21 different countries. Most of them come from Afghanistan, Pakistan, Syria, and Somalia. And the legal status can be different. There are asylum seekers, or they're in the phase of family reunification. So what's been done? to home project very briefly and to see how the pyramid of IASC or WHO we presented is being followed. We are starting by covering basic needs: shelter, food, information. And what does that mean? Providing all these basic things means that you're starting to give a sense of safety to these children. And of course, providing the sense of safety is different from security, because security you can have in a camp with cameras and guards and so on, but building the sense of safety into the community, but with houses that are open to the local community, is something that has to do with building a trusting relationship with the children and with all with everyone involved. On the second level, we have everything this staff does to provide legal support, access to health services, social services, mental health services, and so on. For example, even in health services, there are many barriers. It was a very characteristic example was during COVID, but of course, everything, all kind of care like education, later activities, and everything that was provided for the children had to continue with all the changes that COVID brought. But even though the Greek state, as many countries, had campaigns to convince people to have the shot, the anti-COVID shot. These children, because of their legal status, they didn't have access to basic coverage against COVID. So it was, I think it's a very clear example how many times the state, even if it says that it wants to provide specific services, brings barriers to it. And I mentioned, you see that I highlight legal support because each of the shelters has their own lawyer that provides legal support to the student and adolescents. And it's important because many times if you ask the student what is the main problem for you regarding mental health, they will say that I'm anxious because of my legal status and what will happen with my legal status, or I want information about all this, not only being able to win the case, but also to be aware of what's going on. Then we have other that we try to provide different kinds of social opportunities for social development and integration, like leisure activities, sport activities, art, as any children has. Then there is, we talk about positive educational experiences. The law says that every child in Greece has, according also to international international law and conventions, that each child should attend school. But attending school doesn't mean if you go to a school but nobody speaks your language, or you're not able to participate, or there are too many problems, practical and otherwise. This is not a positive experience. So we must find ways to support with non-formal education or to try to find different kinds of support and educational settings, so children start having positive educational experiences. Then as they grow older, a very important thing, of course, for everyone is having something to do, having a meaningful activity or access to work and income. So here we are talking about professional training, on-the-job training, but also we have seen that it's very important not only to see what the student want to do in their life and show them ways to be trained on it, but for example, to help them find a job, or also when they find a job to make sure that they are secure. Because we have seen many times that since we are talking about young people who are refugees, many times employers try to abuse them. So there is the staff of shelters can play a role on monitoring and supporting also on that. And of course, there is always the need for mental health services, for psychiatric care, of course, and this is why I have the asterisk, it is the problem that Chrysanthi has mentioned. The capacity of services, of the state services for children and adolescents is low in Greece in general. We know that, and there are many reports and publications that describe this situation. So again, the staff has to play this role that is a mediator between helping the student to have access to basic services. So we have to find which of the services of the public health system can support these children. So, as you can see, in another way, at the microsystem, unaccompanied minors in shelters in the community. In the center of, in the microsystem, we have the other children, but it's very important for them because since they have all these traumatic experiences for being separated from their family or the country and so on, sometimes it's very difficult for them to build new relationships and trusting relationships. So we work very, we have to work very closely to helping them to have an enabling environment that will help them develop emotionally and psychologically and so on. The mesosystem, and here I have to do this, I think it's a very important stuff that the role that these professionals, and again, I have to mention that we are talking not only about specialists like psychologists, social workers or psychiatrists. If we train and support and supervise people with different backgrounds, we have seen that they are able to provide very important and useful psychosocial support. Because these people are playing the mediators with the neighborhood, with the services, with the labor market, and so on. Of course, always there is the macro system, the immigration policy in the country. What does it mean for someone to be an immigrant or a refugee, and so on? The values in the education system, how well the schools and the education system works in Greece in general, and so on. And of course, research and literature says that it's difficult to study the macro system, but of course, always we must have in mind that it's an issue. So the barriers in implementing this approach, the socio-ecological approach to psychosocial support of refugees. First is the national policy. Chrysanthi said that there is some years that we have a national policy, national strategy from the Special Secretariat for unaccompanied minors, but it needs a lot of time to be implemented, to have full power. There are issues of funding, there are issues of changing laws. So again, the national policy is not helping. That means that the actors that Chrysanthi mentioned before about the different actors providing child protection and residential facilities for these children and adolescents may have different ways of approach, different protocols, different fundings, but may also affect their sustainability. So it's not easy to assess what's going on, who is actually helping the student and who is not. So again, since there is no national policy, no specific or not very powerful yet, there is lack of evaluation mechanisms. No one asks for these services to be evaluated. Then, as we said, the education policies for integration of refugees, the Ministry of Education and the Ministry of Migration may have tried to establish some specific support for refugees in schools, but again, most of the times this is not the case. We may have special schools, but they may not be working at the moment, or they may There may be great delays when these classes start, and so on. And finally, of course, shelters is not an ideal way of protecting children. It's a necessity due to previous conditions like having children in detention or having children in camps. But of course, there are much better ways of protecting these children, like foster care and or adoption. But again, this is still not working. Uh, very recently, there was a new electronic platform that may help children get access to foster families. But for example, it's not for children under 12, which means that leaves a lot of many children that are unaccompanied. Or we have seen in practice that many times when parents get into the platform, it's if I may put it very simple, they do not choose refugee children. But this, the reason we have examined this socio-ecological model is that we still need to assess all of these procedures and outcomes we have described. So it can be the theoretical basis of assessing what is going on in psychosocial support of these children and adolescents. We need to develop more training and more specialized training for the staffs, as already something has mentioned. Has been done. And I think the socio-ecological model can provide the guiding vision for this training and for this research. In all levels, we must involve even youth, as UNICEF says, and we have seen it. For example, in the home project, we had this small project on planning the future together, where we had in each shelter there is a community with all residents, all children participating in decision making regarding the way the shelter works. But we try to do some training and we try to support how these communities can become stronger, how we can support children, how we can support youth in general to be part of this kind of decision-making processes, which is not easy, especially for the staff many times. And finally, we have seen that the socio-ecological model has been used in other cases and in support of refugees for developing resilience, and after all, for giving us the opportunity to produce hope, because we think that it's the main thing that these children need to be able to continue their life and to become stronger in their life afterwards. So thank you very much for your attention. Here is my email if you need any more after the questions, if you have any more something you want to discuss. Thank you very much.